All right, it's time now for our weekly update with Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Good morning, doctor. We really appreciate you taking the time to speak with us once a week. Thank you, sir.
My pleasure.
Let's start with this recent development involving outbreaks with Listeria. New updates suggesting a third person has died as a result of this. It's very, very concerning to so many people. And we're reading the symptoms can last for a really long time, for as long as 70 days. How long or when is it likely that the symptoms could show up here?
Yeah, so for starters, we know that there's several products in Canada that had a Listeria, that were contaminated with Listeria. There's been a recall and a lot of communication to the general public that if they have any of these products that you can see up on your screen, to just throw them out, or if there's any concern at all that you may have one of these products and you're not sure, throw them out as well. Now, the incubation period for Listeria can be as little as 7 days, but it actually can also be much longer and measured in weeks and weeks and weeks. That's an incubation period, meaning you're not going to have any symptoms during that time, but then people can get the infection after that incubation period and have symptoms of an infection. The real concern here is in the extremes of age, so the very oldest, the very youngest, also in pregnant women and people who are immunocompromised. That's where Listeria can cause more invasive disease. It can cause a bloodstream infection, and it has a predilection for going to the brain and causing a meningitis, and it can be very serious. Readily treated with antibiotics, not hard to diagnose, but of course prevention is key. So if you have any of those products available in your house, it's best to throw them out.
So if somebody consumed one of these products that's now part of the recall and they notice some of the symptoms, say even a week, 2 weeks, up to 70 days later, what should they do?
Now, if anyone's concerned that they are ill with this infection or quite frankly any other infection, you've got to go chat with a healthcare provider. And, you know, this is one of those things where most people who have a Listeria infection will get a gastroenteritis, a diarrhea. It's not pleasant, but it's usually self-resolving on the mild to moderate end of the spectrum. But for people who are on the older end of the spectrum, the younger end of the spectrum, immunocompromised or pregnant, that it certainly can cause more severe infection, including sepsis from a bloodstream infection and meningitis. And of course, if anyone has any symptoms or feels unwell and they've had contact with that product, it's important to speak with a healthcare provider to let them know, because these are readily treatable.
Moving on to another topic we're following really closely this week, the latest with Mpox. We know the World Health Organization watching this closely. They're having a meeting tomorrow to talk about this. Can we talk about how this strain has changed a little bit since the original one that was discovered in 2022?
Yeah, so there's, for millennia, Mpox has been in primarily in Africa, in parts of West Africa. That's called, just to use the technical term, that's clade 2. And then in Central Africa, mostly in the Democratic Republic of Congo, that's clade 1. And more recently, they've identified a substrain of clade 1, so basically an offshoot of the type of Mpox that was found in Central Africa. I think people are chatting about whether or not this may or may not be more severe or cause more severe illness or may be more readily transmitted. I think it's fair to say that it's premature to have any conclusive statements on the virulence of this particular strain. What is clear, regardless, is that it is spreading. There are many more infections right now in Democratic Republic of Congo and in neighboring countries and countries in the region, including Uganda, Kenya, Rwanda, Burundi. So Mpox is a much bigger growing issue on the African continent. And of course, we know from many other infections, including COVID, including Mpox in 2022, that we live in a very interconnected world. We saw a very large Mpox outbreak in Canada in 2022, and it has not gone away. We still have it here.
And given the outbreak situation that we are seeing in African countries, is Canada at risk of seeing an outbreak here? What do you think?
Well, we already had this outbreak in 2022, and it hasn't gone away. It's grumbling along. So, for example, as of July 13th, 2024, if we're just looking at the 2024 calendar year, Ontario had 102 cases of Mpox. Most of them were locally acquired, not brought in from another part of the world. And if you compare that with all of 2023, we only had 33 cases. So we have locally acquired Mpox in Ontario. Now, of course, said with love, respect, no moralization, no value judgments whatsoever. But our outbreak in Ontario has predominantly been in the men who have sex with men community. In fact, over 96% of all of our cases in Ontario have been in men. So, risk is not equal. And of course, we've had a very large public health response and with leadership from the men who have sex with men community to make sure people are aware of this infection, make sure people know what the risk factors are, lower barriers to vaccines, get the vaccines out there, lower barriers to treatment, and huge kudos to leadership in the men who have sex with men community for informing the community and providing better safety to the community. But again, this is an issue that is grumbling along in Ontario and Canada and many places that were previously thought to not be endemic. And it doesn't seem like it's going away, unfortunately.
And you mentioned vaccines. Vaccines are available for people who would like to protect themselves against Mpox. Do you know how effective the vaccine would be against this changing strain?
So it's unclear with this particular strain. That's a really good point. And all of this is really under investigation. Here's what's likely. The likely scenario is that these vaccines still provide pretty reasonable protection against infection and severe infection if you do have a breakthrough infection. And quite frankly, in Ontario, myself and other people who work in infectious diseases, primary care, emergency medicine, we do see an occasional case of Mpox. And sometimes these individuals who are infected have been vaccinated. So these are breakthrough infections. But again, what you're going to see is the breakthrough infections in a vaccinated individual are far less severe than the infections that we saw, for example, before the vaccines were rolled out. We saw some really sad cases where people were miserable and in pain, and some individuals were even hospitalized with this. I think that's far less common. And in fact, in the 2024 calendar year in Ontario, at least with the 102 cases that have been seen to date, there have been 0 hospitalizations and 0 deaths with those. Obviously, I think we can improve the vaccine rollout in those who are at most risk for Mpox, but many people have received 1, preferably 2 doses of that vaccine, and it does go a long way in preventing infection, but really also mitigating severity of infection if there is a breakthrough.
Dr. Isaac Bogoch, thank you so much for sharing your time with us this morning. We certainly covered a lot, so we appreciate everything you're able to share with our viewers.
My pleasure. Have a great day.
Thank you. You too.